Thank you very much for joining us this afternoon for this webinar, the Engaged MD Experience at London Women's Clinic with Julija Gorodeckaja. I'm delighted to say that we also have joining us today two members of Engaged MD. Firstly, from Engaged MD, we have Stephanie Sehnert. Stephanie has had the pleasure of working for both CooperSurgical and Engaged MD and currently serves as the Fertility Sales Director at Engaged MD. She is passionate about reproductive health and empowering patients through information. And during her time at CooperSurgical, Stephanie spearheaded the launch of the Engaged MD and CooperSurgical partnership. In her current role with Engaged MD, she works with fertility clinics to streamline workflows and improve experiences for clinicians and patients alike. Secondly, joining us also from Engaged MD, we have Olivia Duggan. Olivia is a customer success lead at Engaged MD. In this capacity, she is responsible for helping clinics most effectively use Engaged MD's patient education and e-signature tools to improve patient experience and increase efficiencies. Olivia also manages the partnership with CooperSurgical from Engaged MD's side and works directly with clinics to implement CooperSurgical's genetic testing offerings through the Engaged MD platform. And then we're also honoured to have joining us today Dr Julija Gorodeckaja, who is the clinical lead for reproductive genetics at LWC. It's a real treat to have Dr Julija joining us today. It really brings the subject alive when we have one of our customers speaking about it from their perspective. So thank you hugely to Dr Julija for giving up her time today to speak to us all. Dr Julija trained in obstetrics and gynecology at the Vilnius University Hospital in Lithuania. Since moving to the UK in 2012, she has worked at the Whittington Hospital as a specialist trainee, at the Baltic Medical Centre and at the King's College Hospital as a clinical fellow. Her specialist interests are pre-implantation genetics. Dr Julija has published research in peer-reviewed medical journals and has, through gaining an MBA in international healthcare management, a keen focus on improving patient-centred care. Prior to Dr Julija speaking about her experiences using Engaged MD, Olivia will give us an overview of what the Engaged MD software is and what it does. At CooperSurgical, we provide Engaged MD free of charge as a way to support our genomics customers, and you'll hear today the benefits of this for both your clinic, your staff, and your patients. If you have any questions whilst Olivia and Julija are speaking, please enter them into the chat box and we'll collate all of these questions and I will put them to the panel of Olivia, Stephanie and Julija at the end of the presentations. Thank you very much. I look forward to speaking to you later and I'll now hand over to Olivia.
Wonderful. Well, thank you so much, Emily, and thank you all again for joining us today to go over Engaged MD and how it has been implemented also at London Women's Clinic. Again, as Emily mentioned, my name's Olivia Duggan and I'm a member of the customer success team at Engaged MD, where in this role, my job really is to make sure that clinics get the most out of Engaged MD and are able to use our tools to speed up their current workflows, have more meaningful engagement with patients, and really take hold of these offerings that we have. So today on this webinar, we're going to talk about a few things, and I just wanted to provide a high-level overview before we jump in. First of all, we're going to discuss the challenges that currently exist with patient education and consenting as it relates to genetic testing. After that, we're going to do a quick demonstration of the Engaged MD platform where I'll present and show the tools that can be used to support clinicians and patients through this process. And lastly, we'll finish off by hearing what the patients have to say about this. We've collected a lot of quantitative and qualitative survey results over the years of what the patient experience with this is. And of course, that's the most important part. So we'll dive into that as well. So just to start off, wanted to give you a brief overview of what Engaged MD is. So we've been around for about 5 years, and Engaged MD's purpose is really to make patient education, engagement, and consent easy and efficient for clinicians and patients alike. So there are two kind of verticals of this EngagedMD. The first is e-learning, which is a series of customized video modules, some in fertility foundations, which really introduce the fertility experience to new patients with everything from diagnostic testing to carrier screening, and fertility in the time of COVID-19. As well as treatment videos on IUI, IVF, PGT, and also injection trainings. And we're always building this out, as fertility is a evolving industry. So is our library of educational modules. The second side of this is our e-signature, which allows the distribution and management of paperwork online securely and effectively. So since we've been around, again, about 5 years now, we've educated over 350,000 patients. There are over 500 active providers using EngagedMD, and through e-signature, over 1 million documents have been signed, which is pretty incredible, and growing every day. So to step back a second and give you a sense of why EngagedMD was created, we were, as our founders were thinking about EngagedMD and the problem statements they wanted to solve, the two things that came up are, one, are patients truly informed? So we heard from a lot of providers that once patients realized how much information there was to learn about fertility, they were nervous sometimes. They were surprised by just like the multitude of it all. And these clinicians had no feedback loop to ensure that these patients were truly informed on all that information. The second kind of problem statement was that the consenting process was outdated and often could be inaccurate and very arduous and time consuming. Clinicians spent a lot of time chasing paper, scanning forms, and making sure that these were completed correctly, which caused a lot of frustration. So that's kind of why that second area of e-signature came to be. And in teaming up with CooperSurgical, we really saw that Cooper and genetic testing had the same kind of pain points that we were just discussing. Both in education, there's so much to talk about in terms of genetic testing options, and this is an ever-evolving field as well. So both the clinicians wanted to make sure that they were giving the most up-to-date holistic information, and make sure that it was really taken in by those patients. And then the second half of that is the test ordering. So just as with consent forms for treatment options, as EngagedMD specializes in, the process of sending the test order form for genetic testing also kind of sometimes led to those same difficulties. Like, is the form fully completed? Is emailing and faxing it to CooperSurgical really the most efficient way to do it? So through that, we also allow the ability for test order forms to be sent to Cooper Genomics, as well as the PGT consent to be completed through EngagedMD. So this is where we came today, and why we're having this conversation, to really demonstrate those pre-test education tools that are specific for genetics, offered through EngagedMD, as well as seamless electronic consenting and test ordering for clinicians. And the great part of all of this for your purposes is that these services are included as part of your Cooper Genomics partnership. So you'll be able to get up and running with these at no cost to you. It's already kind of part of your package. So with that said, I've done a lot of talking about education and signature, but what I'm going to do now is jump in quickly to the platform itself to show what this experience is like, both for the patient and then for the clinician side or the staff side. So where I am right now is just in a patient email inbox. Once the patient is signed up for EngagedMD, they'll receive an email like this and be prompted to get started. From there, they'll be brought to a page where they're able to see all the educational modules they're assigned. Again, for today, we're just going to be looking at this Cooper Genomics PGT consent. But if a patient was going through other treatments and wanted more education, again, like we'll hear about with London Women's Clinic later, this page might be a little fuller for them. They might also have an IVF module, maybe some injection trainings, a COVID-19 module. But again, this is kind of what is brought and offered through the Cooper Genomics. So I'll go in here and play this video. I'll turn off the volume because I know sometimes that doesn't carry too well over webinar, Zoom video. But just wanted to give you a sense of what this looks like and what these videos and the experience for patients will be. So we know that there are patients learn in many different ways. So want to include, some live footage alongside some graphics and information to make sure that this information is as digestible as possible for those patients. So this video will continue to play, but just to give you a sense, after the video finishes, the patient will be prompted with a series of checkpoint questions. So again,
Olivia, my apologies to interrupt. We can't
No
see the
worries.
video on the screen.
Oh, no? Okay, 1 second.
And are you able to put your camera on so we can see you speaking as well, please?
I will. I'm sorry
Thank
about
you.
that.
Not
Hello, everyone,
Thank you so much.
and I will change my sharing option so that we're able to see the video and back up just a bit.
Wonderful. Thank you so much.
Thank you for letting me know. Okay, are you able to see my video now or my screen now?
Yes, we can see the screen that's embryo biopsy.
Okay, great. Yes. Okay. So just to give you a sense, because I imagine I've been going a bit for a while with you not seeing my screen, and that must have been frustrating. I'll just take one step back to this page where the patient will see the array of modules that they've been assigned. So again, they'll have a thumbnail here for PGTA, but if there were other modules they'd be assigned, they'd also appear here. So now again, I'll click into this video and I'll start it from the beginning just to give you a sense of what this looks like. Okay, again, so here in this video, you'll see a variety of images to really give the patient a holistic understanding of their treatment, both through live footage and through some diagrams and images to help reinforce and help them understand. Okay, so as this video goes, I will now continue to this checkpoint. And as patients finish each section of the video module, they will be prompted with a checkpoint. So this checkpoint isn't a test per se, but what it does is help reinforce key concepts that were presented in the video, so that patients can really solidify that knowledge, as well as provide the opportunity for clinicians to check if patients are getting questions correct or where there might be areas of pain points or areas where they could dive in with patients a little more to make sure that these concepts make sense. So if a patient answers a question incorrectly, as I just did now, they'll be prompted with a little bit more information, guiding them to the correct answer. And we'll prompt them to try again, to again reinforce that key concept. Okay, so right now, again, we're obviously watching the embryo biopsy section of this module, but there are a bunch of different sections contained within Cooper Genomics PGTA. There's also offerings for PGTM and ER-Peak within this. So if those are offerings at your clinic that you want to provide educational content on, you're absolutely able to. But here we'll see there's an introduction to lay the groundwork, embryo biopsy, analysis, embryo transfer, and an optional section for mosaicism. So if you offer the option to report mosaicism at your clinic, that's a section that can be added into this video. If not, it can be left out as well. Okay, So now that we've seen this patient experience, I'm now going to move over to the staff side of things. So I'll X out of here and jump into the EngagedMD portal. Each user who has an EngagedMD account will have their own secure password and login for EngagedMD. And from there, they'll be able to access this portal from where they can manage patients, add new patients, assign modules, and send TRFs. So I'll just go ahead and pull up that last patient that we were looking at before, Jane Smith, and I'll dive into her patient record. From here, I can see that just as we have seen, she's 1/5 of the way through her modules. I can see this progress and even, dive in a little deeper to see what she got correct and incorrect if I want to see that more granular detail. And I can also from here dive in and send out the TRF, the test order form, through her patient record. So again, this is the second side of that offering for CooperSurgical. And if I just click Sign Document, as I'm doing now, it will bring up DocuSign, which it has a partnership with EngagedMD through EngagedMD to send out electronic forms. So here we see that a lot of information has already been pre-filled in this form. Jane's name, the clinic ID, the email address, etc. And all the fields that require input from the clinic are listed here and able to be filled out. There's some smart logic built in here so that if other is clicked, this field will pop in just to ensure that accuracy is maintained throughout this form, and that only the correct boxes are being checked and the correct fields are being filled in, so that by the time it's sent out and copied over to the CooperSurgical team, this form is completed in full. All right, so those are really the two sides. It's a pretty straightforward, easy process of both sending forms and managing them. So now I'll jump back to my demonstration or to my slide deck just to get a sense of and cover again those key benefits that we see from EngagedMD. So as I've covered, our goals are to comprehensively inform patients and make sure that they're receiving all the education necessary pre-treatment, make those conversations more effective and efficient with their clinicians. So the goal of this education isn't to eliminate those important conversations, which we all know are so important and so necessary, but rather to supplement them and make sure that once the patients come in and have those talks, they're more informed as a baseline. And additionally, in the time of COVID-19, provide that education at a place where the patients are comfortable and able to access it. Next, to streamline the process to make sure that patients can do this from their home, from where they're comfortable and in the most easy and efficient time. And then from the practice end, you're able to distribute this education and these forms in the quickest way possible, and also increase patient satisfaction, which is the one thing I haven't gotten to specifically yet, but that's what we've heard over and over again from our patient feedback. So 97.4% of patients have felt that the EngagedMD videos were a helpful addition to the consultations with their medical team. So again, not replacing those, but making those conversations more worthwhile. And again, almost 74% of patients said that learning about their treatment through EngagedMD made them more satisfied with their care. So not only did it help them go into their care, but it improved their experience overall. And then one quick note, one quote from a patient: "The videos gave me an idea of what to expect throughout the entire process and answered a majority of the questions that I had about testing my embryos." Right. So that is all I have today before I turn it over to Julia. But of course, if you're interested in learning more about EngagedMD, please reach out to your CooperSurgical account manager or visit engagedmd.com/Cooper, where we have a full page of resources. And of course, if you want to reach out to me directly, I'm happy to answer any questions as well. My email, pretty simple, is just olivia@engagedmd.com, and I look forward to talking with you. All right, Julia, I will turn it over to you.
Thank you very much, Olivia, for the lovely introduction into EngagedMD platform. Today, I'll be talking about the London Women's Clinic experience with EngagedMD and how do we feel our patients and our clinical team benefit from this collaboration. I think that it's fair to say that our first point of contact with EngagedMD team was in August, September 2018. So that was 2 years ago already. This was the point in time where at London Women's Clinic Bridge Center, we were running a very successful pre-implantation genetic testing program and had quite a few patients coming through for that particular type of treatment. And majority of those patients were very well looked after by our genetic counselor. However, when she decided to leave, we were left without that support that we were very much used to. So then we turned to Cooper Genomics, which more or less at that time went extremely global and international, and from a very local and very cozy genetic testing lab turned into this global phenomenon. And we asked them whether they have any resources to support us, at least in the interim period, to make sure that the patients are equally supported and clinical team doesn't feel particularly lost in that process and in that transition. And at that time, the Cooper Genomics team said, oh, by the way, we have this wonderful collaboration with EngagedMD, who does provide exactly what you're asking for, which is a very nice, very streamlined, patient-oriented educational module for the PGTA testing of the embryos. So we've started the conversation. We had few initial conversations with Stephanie and other members of the team, and we've learned that the setting up of sending those educational modules would not be particularly complicated. It's very intuitive and user-friendly approach, but each individual patient would need to be set up on the EngagedMD, which is obviously additional work for the clinical team. However, during a couple of presentations, we had a sneak peek at the other slides that talked about IVF educational modules. So that became a little bit more interested, continued conversations, learned about the rest of the educational program that EngagedMD provides to fertility patients outside the Cooper Genomics collaboration, continued conversations, and then learned that not only the educational platform is there, but also the electronic paperwork and electronic consent forms and e-sign part of their business. And this is where the conversation got really serious, because you need to understand that London Women's Clinic is a big group of fertility clinics. It's multi-sited with a number of satellites feeding into it. And so, as Olivia rightfully said, that was our big pain point: the paperwork, the consent forms, and making sure that HFE forms are in place and filled in correctly, and a lot of manual and admin time that has been dedicated at that time to manage just the paper flow. That was also the time where GDPR was introduced, and we were particularly scrutinized towards our approach to patient confidentiality and all those other things. So the EngagedMD, especially from the e-sign point of view, seems like a perfect answer to many of our questions. So the work at that point, so we're talking about the end of 2018, the work towards implementing PGTA educational modules were put on hold because we were really focusing then on establishing relationship and connection to make sure that we go really paperless. that process took us a while. Obviously, it involved a lot of training to the members of the team, nursing team and clinicians that had to be on board with this all new approach, and natural resistance from slow adopters of the new technology was quite obvious. However, the good thing about that approach and that implementation was that our electronic patient record database is mellow with ideas, and EngagedMD is fully integrated with ideas. So you would not need to set up a specific patient's profiles individually. You get access from ideas into that lovely screen that Olivia had shared. So in such a way, we would make sure that every single initial consultation patient or initial contact of the patient had EngagedMD experience from the outset. So we started rolling out that process in the middle of 2019. We started with one of our smaller satellite clinics, making sure that the team had full training, make sure that we've ironed out all the glitches, and that really started from the inquiries. So the inquiries team would send the medical questionnaires to prior the initial consultation to the patients, and also the required set of HFEA registration forms. So in such a way, no additional training was required for the patients, because they assumed that is just a natural part of the process. And so it took a couple of months for the teams to get used to it, but eventually we ended up with every single patient being consented and being acquired through the eSign platform. And only then, because we had this wonderful basis, we built up on the educational modules. In 2020, we really started more focusing on patient education, and the two modules that we're using extensively these days is the general IVF module, and also PGTA module, which was our initial primarily focus. So looking at the numbers from beginning of 2020, we had sent over 200 IVF modules, and we've seen about 60% completion for the patients. So we've sent over 60 PGTA modules with over 50% of a completion. And those modules are sent currently at the time of the initial consultation as a follow-up information to supplement the conversation with a consultant. And because in current days, a lot of consultations are taking place online, it really takes 7 clicks on the screen to send those modules to the patient, and that can be done whilst you're talking to them. So having said all that, we feel that the overall experience with EngagedMD across all of the products was extremely positive. We're currently working with Olivia to implement the test requisition forms, as she mentioned, and once that is done, we'll be fully engaged. Obviously, enormous benefits have been achieved mainly through the streamlining the operations. Huge savings on the admin time, not insignificant savings on the supply time. So we're not printing out those forms, we're not scanning the forms, we don't need to dispose of the confidential information. Not having to read the people's handwriting is a huge benefit on its own. Everything is electronic, everything is typed. So there is no ambiguity in understanding of the information. We also quite significantly addressed the confidentiality question, because back in the days when the consent forms were filled by hand, there was always a possibility for a single partner to fill the questionnaires or information for both partners, and that was usually a female partner. EngagedMD sends individual consent forms to individual patients, and only then through their mailbox can complete the forms, which is absolutely fantastic. We also seen that by doing things in such a way, we have instant access to the information. So we avoid the danger of individual pieces of information being left in certain email boxes and not attached to the system, for example, or attaching to the wrong file, or scanned incorrectly and only part of the information is available at the time of the consultation, all that. But also this year, as we've been focusing on the educational part, we've seen a lot of positive feedback from the patients. They, and I can echo what Olivia had said, patients feel that the very complex processes made very simple and understandable in a step-by-step approach. Patients can always go back to those videos and sort of re-educate themselves or remind themselves of things that they have not fully understood or had forgotten during the process. Quite a lot of times they bring questions for a follow-up discussion. So as a clinician, the huge benefit that I see is that after we've sent those educational modules, the follow-up consultations are not focusing on primarily a basic education, but more on personalized care, which is exactly what our focus should be. So I think that overall, we are very pleased with this collaboration, and currently our operations team is looking after the analytic side of this question, because obviously when you work for quite some time, there's a lot of information on the back end that you can get. You know, what is the patient participation, what is the uptake, what is the conversion rate. So at the moment, it's early days to say whether the EngagedMD had helped us to convert more patients to treatment, but it's definitely allowed the team to feel much more comfortable and confident that they have this extra support, and patients are educated in a very systematic, consistent way, and nothing is missed. So I think that's our experience currently, and obviously I'm very happy to answer any further questions if there's any.
Thank you very much, Julia, and to Olivia as well for their talk. So I'm going to ask Stephanie and Olivia and Julia to switch their webcams back on and unmute themselves. Thank you very much. And you're our panel now. So I've got quite a few questions that have already come into the chat box. Please do keep those questions coming in, people. Anything that you want to ask, now is your opportunity. And I will address the questions to the panel. So where should we start? Julia, I did like that comment about not being able to read people's handwriting. As someone who sometimes cannot read their own handwriting, I really appreciate that as an unexpected and unusual benefit of the system that I hadn't thought about before. So that was a nice comment.
Absolutely.
First question here for Julia. How has EngagedMD changed your team's workflow?
How does that change the workflow? Well, obviously, it's very difficult to answer this question in one sentence, but I think that if you compare what we used to have 2 years ago, where we had offices of consent over consent form flying around, I think that we really went paperless, right? So I think that the initial and primarily benefit is instant access to accurate information at the right time, at the right place, right? And so that is a huge benefit on its own, right? So you don't need to chase, you don't need to look for the form, you don't need to go with the emails back and forth. And obviously with the pandemic and with the lockdown, with a lot of team members working remotely, you know, that is absolutely crucial, right? If you have team in the same office, then it's quite easy. If you have teams, you know, scattered around multiple locations, then obviously chasing for something becomes really, really tiring and unnecessary. So we've addressed that. It's also quite easy to look through the consent forms, and because some of the consent forms need to be signed off by 2 members of the team. So that's usually my nursing team and then the clinical team. You can do that from your phone, right? If you have access to your email, to your work email through your phone, ultimately you have access to all the consent forms. So you can do those forms over the weekend. You can do those forms as and when needed. When someone needs your signature urgently and you're on holidays, right? Treatment is not put on hold because you can sign, because you actually can. And I think that's absolutely amazing.
Brilliant. Thank you so much. More technical question now. Stephanie, perhaps you can answer this one. What research has been undertaken on the EngagedMD platform? Obviously, our customers love data, they love science, and they want to know what research is out there.
I love data and science as well, so happy to address that question, Emily. So there's been a couple research studies that have been done on the EngagedMD platform. There was one published in Fertility and Sterility a few years back that is easily accessible. If you just search Fertility and Sterility, EngagedMD, folks can find it. But at the upcoming ASRM virtual conference, there are a few different abstracts being presented. I believe there's going to be 3 oral abstract presentations and 1 poster presentation with additional research that's been done on the EngagedMD platform. One of them in particular is specifically looking at those patient survey responses to how the EngagedMD platform, specifically the CooperGenomics PGTA module, has helped patients make informed decisions about testing. So that's what I'm particularly excited for.
Super. Thank you so much. Next question here. This one's for Julia. Quite a topical one, Julia. How has EngagedMD helped your team during the pandemic?
Oh, that's a very good question. That's a very good question. I think that during pandemics on the social media, we've seen a lot of memes, and one that I love, especially is a question: who drives your company's digital transformation? Is it CEO, COO, or COVID? And I think that EngagedMD helped us to be fully prepared for the pandemic, because again, it enables the team to be fully capable of working from home and still maintaining the same quality of care. And I think that is absolutely amazing.
Lovely. Thank you so much for that. Technical question here for you, Olivia. So how long is EngagedMD available for patients, and can they, if they leave it, can they pick it back up again?
Yeah, great question. So EngagedMD is accessible for patients from the time that they're assigned all through whenever they want to come back and access it. One thing to note is there are, due dates set for each module that patients receive to remind them to watch their modules in a timely manner before their next touch point, typically, but this isn't an expiration date after the fact. If they want to return to this and be able to pick it back up, they'll be able to do so on their own time and never lose access.
Oh, that's wonderful. So they can stop and they come back, and it's all very
absolutely
flexible and fits in with our busy lifestyles.
Exactly.
Oh, super. Thank you.
Yeah.
Stephanie, you may be able to help with this one. Is there any information referencing the HFEA traffic light system to PGTA on EngagedMD?
Very good question. I know that there were changes made to that just recently. So while there's not currently a reference to the traffic light system within the existing modules that we have, one of the really nice things about clinics working together with EngagedMD is, as Olivia mentioned, we're a relatively young company. I like to say old enough to know what we're doing, but young enough to still be really quite nimble and adaptable. And a piece of that is that we're always collecting feedback. We're collecting feedback from clinicians, collecting feedback from patients, and actually using that feedback to make changes to our content over time. So while that's not something we have available today, it is something our team is discussing making a change on. And the more feedback we get from folks that they'd like that included, the more information our team has. So I would definitely encourage folks to talk with their EngagedMD customer success lead or their CooperSurgical account manager and pass that feedback to us so we can make those changes if folks would like to see that done.
Great. And would that be, say, in general, if for example, Julia came to us and said, I've got some suggestions for changing, improving, adding to the content, and that would be the process to give that feedback to you?
Yeah, so for the CooperGenomics modules that we've put together in collaboration with CooperSurgical, those are really built together collaboratively. But for all of the other modules that clinics can purchase through EngagedMD, like Julia mentioned, the IVF module, for instance, they're all fully customizable at the clinic level. So we recognize that every clinic practices medicine a little bit differently. So if there's something within our existing module sort of template or standard module that clinics would like to change, that's quite easy for us to do. And like I said, very, very simple to customize things. Our goal is to make sure that the information that clinicians are sharing with patients through EngagedMD is as close to what they would be saying to them in office without having to spend that time. So happy to make those personalizations as needed.
Can I just add something to that? Obviously, you know, changing videos is quite a long process. It cannot be done overnight, but if you're working, for example, through the EngagedMD platform the way that we do, then you have an opportunity to put all of the patient information there the way that you want. So that could be individual to the clinic, and you can send your own internal consent forms through that, your internal patient educational leaflets through that. And that is very easily and very quickly changeable thing. So for example, in such a way, we sent all the internal Zika information. For example, we sent all the COVID-19 triage questionnaires and information, and also information on social distancing and using the PPE for everyone who's coming physically to the clinic. And that is under constant review, and change of that doesn't take much time. It doesn't need to involve the rest of the customers of the EngagedMD to serve your own patients population. So that's that. And I see in the question panel a couple of questions with regards to that. So yes, all your internal consent forms can go through the EngagedMD, and all HFEA consent forms can go through the EngagedMD as well.
Brilliant. Thank you for that, Julie. We have got a few questions here on consent, so I just want to make sure that that's all clear and everything's covered. So can all the HFEA consent forms be completed through this system? Stephanie, Olivia, Julia?
Absolutely.
They can, yeah. And one cool thing that I don't know if we've shared is we also offer educational modules to help support patients in filling these out and in understanding what they mean. So really allowing patients to have informed consent, not just a meaningless consent signature.
Great, thank you. And some specific questions here. Are consent forms present for fertility treatments in this platform?
All consent forms can be added to EngagedMD. There's really no limitation. We can use the HFEA consents. We can use clinics' custom consents. There's no limit to what we can host for clinics.
Great. So in that case, then, all the content found in the current HFEA forms can be put onto the consent forms from EngagedMD.
Correct.
Thank you very much. If there's any more questions on consents, please keep putting them into the chat box, and any of the topics as well, and we'll get through them. We've got a few more questions here. Julia, I'm going to come back to you. You alluded to some time savings that the system EngagedMD gives you. Are you able to say how much time you think it saved your team?
Well, I think that it saved our team a couple of full-time admin people time.
Wow, so that's quite considerable then.
That's quite considerable. And obviously, you know, I think that our clinical time is a little bit more focused now onto providing patient care rather than, you know, the paperwork and all the admin part of the job that surrounds that. So it's very difficult to quantify, right? But I think it's not insignificant.
Super. Stephanie, Olivia, are you aware of any quantification that other customers may have done on time saving?
Speak to that. So it definitely varies practice to practice and clinic to clinic. But I think for most clinics, they'll see, if they're using our eLearn and our eSign platforms, they'll see about an hour's worth of time savings per patient or more. I think we've heard 60 to 90 minutes per patient when you take into account both clinical and administrative time. So that is definitely a very reasonable expectation.
Super. Question here, a little bit of a specific one. Excuse me. We have a customer here who uses our ERP but doesn't have a PGT program. Can they still have EngagedMD free of charge just for ERP? Stephanie, Olivia?
Yeah, Olivia, do you want to take that one?
Sure, and my internet is going in and out, so if I chop out, then Stephanie, you can take over. But I believe the question was along the lines of, can ERP be used on EngagedMD if there's not a PGT program? Is that correct? Okay, yeah, absolutely. There are ERP modules that we have and that we've updated within the past year that are available to be sent out through EngagedMD, just as the GT one we were looking at has, as well as the test order form for ERP can also be used through EngagedMD.
Lovely, thank you. A nice comment and question here. Interesting use of the system to collect feedback and surveys. Can you upload a form to multiple patients en masse, or would this need doing on an individual patient level?
I think I may be the person best equipped to answer that. So it's a really good question, and something that we saw a use case for when the pandemic first hit, right? Clinics needed to mass consent patients for treatment during COVID. So this is not a sort of standard use of our platform, and it wasn't a feature that we had built and widely available, but we have been able to do this and sort of create custom workflows for some of the clinics that we work with as needed. So not something that's standard, but something that we've been asked for enough times that I think may become standard in the future.
Wonderful. Thank you. We clearly have some people joining us today from outside of the UK and Ireland, and you're very welcome to do so. And they'd like to clarify, which countries is EngagedMD available in?
Yeah, definitely the UK and Ireland. We also operate in the US and Canada. We recently launched our Cooper Genomics offering in Japan as well.
Wonderful, thank you. Julia, one here for you. Have you had any feedback from your patients about EngagedMD, and what kind of comments have they made about using the system?
I think that the comments are twofold, and they really depend on how much information you're willing to provide to patients. So overall, the experience is very positive. It's very user-friendly, very understandable. So, and very modern and up-to-date, right? And a lot of patients do appreciate that, being able to do a lot of things from their phone screen, because about 80% of the current communication is done through the phones, not through the stationary computers. So I think that's absolutely great. But obviously, for our clinic specifically, there is a proportion of a feedback that says that the questionnaires are too long. But that's again going to vary from clinic to clinic. The great thing about that is that patients can pause at any point in time filling in those forms and come back to them and pick up where they have left, or come back and change the answers or amend the forms later on, right? So that allows them to really focus, go back and think about that, and provide the very accurate information that otherwise would have been missed.
Lovely, thank you so much. We've got a follow-up question here, which may be again related to the fact that we've got some people joining us from overseas. Is there any feedback on how patients with limited English have got on with EngagedMD? I guess that's possibly very patient individual specific, but any thoughts on that, Stephanie and Olivia?
I can speak to this. So I of course don't interact with patients directly, so I don't have direct patient feedback on this. But what I can say is that we do have consent forms that are able to be shared in any language. So any consent form or any different language that your clinic currently has consent forms in, we can support on EngagedMD. And then from the module side of things, we currently have our IVF module available in Spanish as well as English. And we're working to release modules in Mandarin in the coming months as well. So those are a few things that are either currently available or in the works. But again, any feedback that folks have on things that they think would be useful, we are really quite open-minded to. Julia, do you have any direct patient feedback to share here?
I wouldn't say that we have faced a lot of difficulties with that, but every now and then we do have patients that struggle with English a little bit, and I think in that perspective they do appreciate all of the information being sent far in advance to them, and having an opportunity again to maybe invite a friend or an interpreter to help them navigate through questions. Obviously, there are scenarios where that is also very difficult, and then the clinical team is very, very happy to support patients with that, but en masse, majority of them are absolutely fine.
Lovely, thank you. I'm going to ask you a question now about the implementation, Julia. So how smooth was the process of implementing EngagedMD, and also taking into account the whole IT process there?
Well, I think that's, it's not so much the IT, as I said, the interaction between ideas, our database, and EngagedMD is very smooth and straightforward. What was the bigger obstacle is the willingness of the team to buy into the new approach, because obviously any new change, and especially any new change in the horizon of the new technologies, creates a lot of anxieties. And we had certain members of the team adapting to the changes quicker than others. So I think that was the bigger challenge, the buying in and the compliance from the clinical team to sign in the consent forms, to look into them, and to really transition from paper-based to paperless. I think that was a big question in its own, whether you use EngagedMD or any other platform. That is a huge change for some, and I think that took a while to overcome this. Other than that, I think that it was really smooth. Obviously, setting up the accounts and all the manual background work had to be done anyway, and the bigger the clinic is, the more of that work you need to do before you launch, and there is an inevitable transition period where things are duplicated and some questions are raised. But once that's ironed out, I think that you would not want to come back to the previous mode of operation.
Oh, good. So once people had adapted to the change and moved on, they
Yes.
liked it.
Absolutely.
Super.
Absolutely.
Olivia, Stephanie, how secure is the system?
Quite secure. So I'm happy to address this one. The way EngagedMD is set up is we'll create a unique clinic portal for each practice that we work with. So there's no sharing of data between clinics, and of course compliant with GDPR and other local regulations. But one of the questions we get most frequently with regards to security is, how do you make sure the person signing their consent form, since it is all electronic, really is who they say they are, if you no longer have in-person witnessing or steps like that in place? And we have several different measures to account for that, because that's a really core part of what we do as a company, and what we offer is helping you make sure that this system is secure and you can depend on it. So our sort of baseline authentication measure for all patients who are signing documents is email authentication. So someone from the clinic will input the patient's email, whether that's done manually or through an integration with an EMR like Julia mentioned. And then the patient has to log into their email account before they can access their document. And patients and their partners all sign separately and are authenticated separately as well. On top of that, we have options to add in text message authentication or even ID verification if clinics want higher level security on some of their documents.
Super. Thank you for that reassurance. Julia, a question for you. I really like this one. Do your clinicians notice a difference with patients who have taken EngagedMD modules?
I think they do. I think that I will be brave enough to speak for the whole clinical group. I think that the conversations are much easier once the patient have been educated. So I think that, the very simple things, the vocabulary, what is the blastocyst, what's the biopsy, what is PGTA, what is mosaicism. All of those things are explained in such a simple but yet professional way, then you really don't need to re-educate the patients. And I think that, at least in my practice, those are the conversations where patients talk more, right? Because then you ask the question, what do you understand about PGTA process? And then they tell you what otherwise you would need to tell them, right? So I think it's very nice way of checking that they've absorbed information, understood the information, they understood potential benefits, steps of the process, and you really get an extra reassurance that it is a really informed consent rather than just a consent.
Lovely, thank you. So a follow-up question from me. Have you found any other key benefits to using the system at London Women's Clinic?
Any other than I've already mentioned?
Yeah, well, any other, what would you say would be a key? I mean, that one with the patients, understanding and so on. But are there any other, what would you say would be the key benefits?
Well, the key benefits, again, you know, the whole admin part of it, the ability to access the information when and where you need it, very straightforward, timely interaction with the patients, and a huge benefit on education. And not only of the patients, but also for the team members, right? Because I'm not sure if I'm allowed to say, but we can watch those videos as well in a team. And so if newer members of the team are joining us, especially, for example, nurses or the embryology trainees, it's a very nice way to show to them what information patient receives, right? So that the interaction with the patient can be on the same level and same language.
Oh, that's a great use. Thank you for that. We've just had one last question come in, and then we will wrap up. If, for example, you were using the system for legal parenthood, i.e. WP and PP forms, how would you carry out an audit for consent, accuracy and effectiveness? I'm not sure what WP and PP form stands for.
Those are legal parenthood consent forms, okay. and you know, these are the consent forms that you need to be especially careful about, right? And we're very, very high on that. Obviously, we have the whole clinical governance team and quality management control team, and that's usually the PR's responsibility to carry out those consent forms. But I think that from my understanding, I think one of the benefits for those particular consent forms is that the electronic signature has the time stamp on it, right? Because part of those consenting forms is that they have to be done before the treatment had taken place. So they cannot be backdated. And you have the time stamp as to when the patient had signed those forms, but also when the clinician contrasigned those forms, and you cannot trick that. And I think that is a very, very important aspect to it. So this whole electronic signature has a time to the second stamp on it, which is absolutely fantastic.
Thank you, Julia. Stephanie, Olivia, I don't know if you've got anything else that you would like to add to that one.
No, I don't. I think Julia covered it well.
Wonderful. Thank you. Thank you so much for all of the questions. We're going to have to leave the questions now because it's gone 1:30, and I'm conscious people have got to crack on and get back to their jobs and so on. If you do think of any other questions, please don't hesitate to get in contact with us. And it just remains for me to say thank you very much to all of our speakers today. Thank you to Stephanie and Olivia for joining us from the US. I guess you have to have your breakfast now. And a huge thank you as well to Dr. Julija from London Women's Clinic for being really engaging and a wonderful pleasure to listen to today. Thank you so much, Julia.
Thank you.
And of course, thank you. And of course, thank you so much to all of you who've tuned in and for all of your questions. Thank you so much for listening to us today. If you're interested in finding out more about EngagedMD and using this to support your clinic, your staff and your genomics patients, please reach out to your CooperSurgical account manager, or you can contact us at customerserviceuk@coopersurgical.com. That's customerserviceuk@coopersurgical.com. Thank you very much indeed for your company, and we'll look forward to seeing you on our next webinar. Thank you so much.
Thank you for having us.